Hello, everybody. Thank you for the invitation. I would like to thank Sanofi for the invitation. It's a pleasure to speak with all of you in China. I'm Antoine Daher, the president of Casa, and I am here to talk about our project, Casa dos Raros, a new model for attending patients with rare disease. Casa dos Raros, the House of the Rare, is a history of partnership and innovation and engagement between me, Antoine Daher, and Professor Roberto Giuliani. I'm a father of MPS II patient. I'm a businessman. I have a master's degree in political and administrative science, and I'm founder of Casa, co-founder of Casa dos Raros, president of Fevereiro, the Brazilian Federation of Rare Disease Associations. And Dr. Roberto Giuliani, he is a geneticist, very famous in Latin America and in Brazil and in all the world. He's a founder also of the Institute of Genetics for All, co-founder of Casa dos Raros, and founder and member of the Service of Genetic Medical in the clinical hospital of Porto Alegre in the south of Brazil. And he is also a member of the Academy of Sciences in our country. Before talking about Casa dos Raros, I'm, first of all, the president of Casa, and Casa was the beginning of everything. And I would like to talk about the principal achievements that we did in our country. We have a lot of projects like continuous education. We have a virtual library on YouTube. We make lot of webinars and events. We have 2 annual events, big events. The first of them is the scenario of rare disease in our country, when we gather all the stakeholders and all the principal players in our country and in the world. Also, we have the participation of the federal government, the state governments, the congressmen, the regulatory agency from our country, from also other countries like FGA, NICE, EMA. And also we have the Rare People Award. Also, it's a big event that we did every year. And we make also more than 15 campaigns like thematic weeks in every disease to make awareness and to be more close to each patient in our country. And also we create the Day Hunter projects. The Day Hunter project now, it's like a multidisciplinary services when we put together more than 15 professionals of health from doctors and non-doctors in the same day and the same place to attend these patients, to make the diagnosis and also to cut the line of the journey of these patients. Because in our system of health, the patient has to spend more than 4 or 5 years to pass by all these professionals. And then Casa has this project in 4 states to help the patient to have access on the best diagnosis and to have a plan for managing the disease. And this idea, the Day Hunter project, will give us the light to have to build the Casa of Raros, the House of the Rare, to have this service every day, not only 1 day per week. And in only the 2019, we attend more than 4,000 patients and caregivers. And also, we cannot make anything happen in our country in national wide without working in public policies. We are responsible to change and improve the regulatory aspect, the regulatory resolution in our country. We made lot of resolution at Anvisa and at CONEP, like clinical research modernization, orphan drugs fast track, special procedures, guidelines, and also gene therapy guidelines. Casa Hunter was responsible to make all this happen in our country. And 2 years ago, we just approved a new law in our country, the newborn screening expansion. We had only 6 diseases in our unique system of health, newborn screening of only 6 diseases, and we made the expansion to more than 50 diseases. And this is very important to us and to all the patients and to all the centers of reference in our country. I would like to give you an overview to understand the local scenario. Brazil is the one of the big 6 in size and population, 6 countries. And as you see here, we have China, the first, India, USA, Indonesia, Pakistan, and the 6th in position is Brazil. Some facts about Brazil, understanding the challenges of the country. We have, as I said, 213 million of inhabitants. We have a half of South America and third of Latin America in population. Okay, we have one main language, the Portuguese, and as you see, we have is a important point to also to mention the infant mortality. It's 14 by 1,000, and life expectancy is 75 years. Okay, and we have also 13 million with rare diseases. Because defining rare diseases, we have a different concept from Europe, Brazil, and United States. But in Brazil, we consider it as a rare disease if we have till 65 people with into 100,000 people affected with the disease is considered a rare disease. That's why making the calculation, we have between 13 till 15 million of people suffering with a kind of rare disease in our country. Talking about the reference services in our country, we have more than 20 reference center in our country and more than 40 service a hospital who attend also patient with rare disease. But the problem is not to have the reference center. The problem is the model adopted by the government and by the reference center to attend these patients. That's why also one more point who give us the challenge to build the new model called Casa dos Raros. Why Casa dos Raros? Bringing lasting changes, a new ecosystem in rare disease. Because in the unique system of health, as you see here, in our curing state, the patient has to pass in 10 steps from the first symptoms till the search for rare disease specialist. And then he will spend more than 5, 7 till 10 years to have the correct diagnose, and to be attend with all the professionals, with all the multidisciplinary team. Now we have a line in all the state of Brazil, in all these reference centers. Let me explain better. First of all, the patient with rare disease go to a public hospital or a private hospital. And once he is addressed to a geneticist or a specialist with rare disease, he has to take a file in all these center of reference. And the file is at least 1 till 2 years to have the first attendance with the first specialist. And as you know, all these kind of rare disease are multisystemical disease. And then he needs a multidisciplinary team. He needs to be attend with all the specialists. And then to be attend with all the specialists and to make all the exams, he will run more than 2, 3, 4, and 5 years to have everything done. And as you know, 30% of these patients died before 5 years. And then 30% of these patients died in the line, died without having the diagnosis. This is very insane. That's why the objectives of Casa dos Raros is to create a rare disease ecosystem in Brazil, to reduce the duration of the patient journey between the one set of symptom and diagnosis, to have a multidisciplinary evaluation, to promote public policies to accelerate and expand the treatment access, to train and guide doctor and multidisciplinary teams, and also to have research and development, have clinical trials, provide continuing education and training for health professionals. The first Casa dos Raros, we made it, was in Porto Alegre, in the south of Brazil. Okay, I will show it, the video, I will show the video in the end, and will be inaugurated officially in this month on 28th. And the same day, we have the court in China, and the same day that we have the International Day of Rare Disease. And we have here some of sponsors. Sanofi is in these sponsors. Here we put only the industry sponsors. We have also individual sponsors, and we have a lot of services to offer, like multidisciplinary care to rare disease patients and caregivers, specialized laboratory tests, healthcare team training, clinical research and innovative technology, genetic counseling, and also data collection, biobank, and registry. I know that all of you know about what's important in each of these items. Very important to have data collection, to have biobank and registry for all of us. We have a partnership here with the state and municipal health department in Porto Alegre, Rio Grande do Sul. We have with two principal hospitals, the public hospital of Santa Casa, because we will attend 60% public and 40% private. And the hospital Moinho de Vento is the second best hospital private in our country. And we also have the two university, Federal University of Rio Grande do Sul, because we will make the continuing education with them and to capacitate more professionals of health to work with us. We have also Instituto Caldera, University of Pennsylvania, and we do part also of network centers called Undiagnosed Disease Network International. Our governance, it's very important to all of you to understand that each achievement for us is based from transparency and ethics. That's why we like to show you our model of governance. We have a General Assembly who has a national governance. I'm now the president of this assembly, and we have in each state a council, administrative council. Dr. Roberto Giuliani is now the president of Council of Porto Alegre, of Casa dos Raros, and we have also an independent auditing. We have KPMG, who is making like pro bono our auditing, and we have a governance committee and two executive. We have executive superintendents and a clinical superintendents, and we have also legal department, ethical and compliance committees, and ethics and research committees. And as you see here, everything is very organized to show more transparency and ethics and to have sustainability in our projects. It's also important to mention to all of you that in our governance, it's not allowed that any member of the assembly, General Assembly of or the council, administrative council, to be paid or remunerated by any kind of work. It's all of them are totally volunteer because we don't like to have any conflict of interest. We want to have our cause to be the principal base and the principal direction for all of us. That's why we need to have Casa dos Raros as a case, to give Casa dos Raros to all of you as a case that can be implemented in each country. Our commitment and our plan to the future is to have in each region in Brazil, we have 5 regions in Brazil, is to have Casa dos Raros in each region to Brazil. And the next step that we want to make it is São Paulo, to have not only a center like Porto Alegre, but also to have the first hospital in the world totally integrated and dedicated to rare disease. And I will show you in the next slide. That's it. This is our next plan. The first in-class, fully dedicated hospital to rare disease patients. We have already the land and in a place, it's is very important place next to the airport, next to all the equipment of health, and next to other big hospital in our country. It's a strategic place that we are going to build this hospital. And this is a plan for the next few years. Not easy to make it, but we are very committed and we are working hard to have this dream come true in the next few years. And what we will have in this hospital, we will expand, of course, all the services for rare disease ecosystem. We will have a patient care, outpatient and hospitalization, information unit and remote support for diagnosis and treatment, support procedure, therapeutic procedures, laboratory diagnosis, lab and research, clinical research unit, training courses and events, projects, technology evaluation unit, administration, communication, and marketing. And we will have 20 rooms of multidisciplinary outpatient clinics, day hospital 8 beds, hospital ward 91 beds, surgical center 2 theaters, intensive care unit 20 beds, facilities for meeting up to 200 people. And why? This is not too much for attending all who suffers with rare disease, but we intend to make in this hospital like the base unit, and we will work by this hospital will work with a big network of hospital, public hospital and private hospital, and we will make the protocols, and this hospital will work with a big network of hospitals, because we cannot attend all these patients alone, but with our hospital who will be responsible for making the protocol and who will be responsible for allocate all these patients for public and private system with our support and with our control. That's why we will offer our service to the municipal state, to the government state, and to all who needs any kind of support. This is what we want to do, to bring this new ecosystem to our country, and we are going to do it in Rio Grande do Sul, and we plan to do it in all these regions in Brazil, and who knows, maybe we can do it in other country, maybe one day in China, in United States, in Latin America. Okay, this is not only our projects. This is the project of each patient who need dignity, who need support, who need a real diagnosis. This is the project created to be a model for all of us to change the history of rare disease, not only in Brazil, maybe one day in all the world. Thank you very much for all of you. And now, before the end, I'd like to show you a briefing, a video, a small video, to know a little bit about Casa dos Raros, Porto Alegre, and São Paulo. Thank you very much. Before ending, I would like to mention that this process is already ongoing in Brazil, and I would like to share, if all of you or any one of you has the interest to know about what we are doing here in Brazil, or want to share all this information, we would like to share our concept with all of you. And if someone has the interest to collaborate with us here in Brazil and to take the Casa dos Raros of a case to China or other place in the world, we are ready to collaborate with all of you. As I say to all of you, this is not our project. This is a patient project. This project is born for the world, not for us. We only are collaborating with our work here, and we need more people collaborating in this project, and we need more collaboration to spread this idea and this case to all the world. Thank you very much for all of you.
To do this.